sequence. Please arrange the statements in order. So can you try to arrange the following statements in order for your abdominal thrust maneuver? Okay. So 1, you stand behind the client, and then you wrap your arms behind the client. Make a fist with one hand. Position the fist between the umbilicus and the xiphoid process, and that's when you push upward. Okay, so it's actually in the pattern already. Next, with your A, B, C, D, E, your burns. Okay, with your burns here, let's try answering. An adult client is admitted to the emergency room following a burn injury of the following parts of his body: left and right palms of the hands, the entire anterior trunk, the left lower leg. Using the rule of nines, determine the extent of the burn injury. First, left and right palm of the hands is how much? Have you had your infectious integumentary lecture? How much is your left and right palm of the hands? It's 3%. Okay, because each palm is 1.5. Okay, so did you have your integumentary lecture already? Did you have it, guys? Not yet. Okay, so I will tell you about your rule of nines. Okay, rule of nines is in order for us to calculate the total body surface of burns, we have to use the rule of nines. So what do you call this? Head is 9. Okay, head is 9. It also consists of the neck. Each palm is 1.5, so a total of 3% if both palms are included. Whole trunk is 36. So anterior part of your trunk is 18. Posterior trunk is 18. So total of 36. Each arm is 9 and each leg is 18. Now here I would tell you a technique, because me, I'm not a person who memorizes things. So I have a hard time with memorization. I only remember 9. Okay, I only remember 9, and by means of tapping myself. For example, when I tap my head, it's 9. When I tap each arm, it's 9 also. When it comes to my trunk, I tap myself 4 times. Okay, I will show my trunk. When I tap my chest, it's 9. When I tap my abdomen, that's 9. A total of 18 still for my anterior trunk. When I tap my upper back, that's 9. When I tap my lower back, that's still 9. So a total of 18 for my posterior trunk. For my legs, of course, I cannot show you my legs. Okay? When I tap the front of my leg, that's 9. And when I tap the back of my leg, that's also 9. Total of 18 for each leg. I hope it helps with you guys. So again here, left and right palms of the hands is how much? How much is the left and right palms? It's 3. Okay, again, because each palm is 1.5. Entire anterior trunk is how much? Is 18. Because when you say entire anterior trunk, it consists of your chest and your abdomen. 9, 18. How about your left lower leg? Oh, since each leg is 18, you only want the half of it, you get 9. So 3 plus 18 plus 9 would give you what? Would give you 30%. Kasali na yung back part sa 18 sa leg. Yes, so your 18, your leg is 18. It consists of your anterior and posterior leg or upper and lower leg. So the whole leg, okay, the whole leg is 18. Okay? I only do nines just because I have a hard time remembering if the arm is 9 or is it 18. Which is which? Okay, so I only remember 9. So with the usage of the taps. So actually guys, when it comes to your TBSA, for you to somehow understand it or somehow have a sense of how much is a certain body part, my tip for you is to look at the mirror. Okay, you practice in front of the mirror, you focus on one part. For example, right now I'm focusing on the head. How much is that? If I'm focusing just on the lower leg, how much is that also? Okay, so that could be a practice for you guys. Next, with your principles of burn care, your burns, blood volume replacement is essential in order for us to prevent shock because with your patients who encounters burns, there would be fluid loss. Urine output monitoring is done to assess for acute renal failure since there is an imbalance of fluids inside the body. The kidneys could also be affected because your kidneys are responsible for your water balancing. Respiratory monitoring, especially for those who have inhalation burns, should be assessed for compromised airway if we need to intubate the client. Nutritional modification entails the need for high protein and high caloric diet. High protein because we need that to rebuild lost muscles or damaged muscles, and high calorie in order for the cells to have energy for fixing what is damaged or to hasten your tissue repair. And lastly, your skincare, it's not your Korean skincare, but rather your skin debridement, application of ointments in order to prevent infection. Now, the ABCs of trauma take precedent over caring for the burn. Always remember, guys, when it comes to emergency nursing, we prioritize ABCs. Okay, because for this concept, what is the point of caring for the burn if your patient cannot breathe? If your patient has problem with their circulation, most likely it would result to death if you do not prioritize your ABCs. Okay? So let's just finish first your burns before we go on with our lunch break. So prioritization of burn clients. In the emergency department, the following clients were admitted. Which client will the nurse consider as a priority for referral to the burn unit? Okay. So first, before we answer this one, let's look at some functional concepts. Your third-degree burns in more than 5% of TBSA in any age group is a priority for transfer to the burn center. Because when you say third-degree burns, it entails what? What skin layer is affected for third-degree burns? What skin layer is affected for third degree? You have your first, second, third, and fourth degree burns, right? For your first degree, the problem is the epidermis. That's your sunburns, right? With your second degree burns, that would be your dermis already, wherein there would be blister formation. For your third degree burns, that's where the subcutaneous or the fatty layer is already affected. And for your fourth degree burns, that's the muscles and bones. There would be eschar formation, charring of the muscles, and there would be no pain for number 4 already. Now, third degree burns again in more than 5% of TBSA in age group is a priority for transfer to the burn center because it means that the burn has already penetrated enough on the skin layer that it could cause damage to the person. And that could also cause fluid imbalance in your patient. A client with second and third degree burns in more than 10% of TBSA is a priority for transfer to a burn center if the client is below 10 years old and above 50 years of age, because your 10 years old and above 50 years of age are considered for vulnerable age group. And your second and third degree burns would cause fluid imbalance in the patient's body. A client with second and third degree burns in more than 20% of TBSA is a priority for transfer to a burn center if the client is between 11 to 49 years of age. So actually, for the three concepts that we had, this one is the first priority, your third degree burns. Next is your patients with second and third degree burns below 10 years old and above 50 years of age. And the last one would be your second and third degree burns of more than 20% for between 11 to 49 years old. So here, let's summarize your functional concept. If if there is more than 5% of 5% of your TBSA that is third degree burns in any age group, they are first prioritized. The next priority would be your more than 10% for your second and third degree burns below 10 years old and above 50 or the vulnerable age groups. And if there are no patients that has 5% or 10%, that's when we go for the 20%. Second and third degree, 11 to 49 years old with second and third degree burns on the face, hands, feet, genitalia, perineum, and major joints. Now, to make it easier for you guys to see who you will prioritize, first, you look for the third degree burns of more than 5% in any age group. If there is none, you look for the second and third degree burns of more than 10%. You check for the age. If they are below 10 or above 50 years of age, if there is no 10 years old or above 50 years of age, that's when you look for the second and third degree burns of more than 20% for the ages 11 to 49. Okay, you also have to note if there are burns in the face, hands, feet, genitalia, perineum, and other major joints. So let's try to apply this one with your question. In the emergency department, the following clients were admitted. Which client will the nurse consider as a priority for referral to the burn unit? Again, first, look at the third degree burns of more than 5% in any age group. Do you see one? Third degree, you see two, right? You have your number 3 and your number 4. Let's look at the percentage of the body parts. Third degree burns of the entire left arm. How much is the left arm, or how much is one arm? How much is one arm? It's 9. Let's look at number 4. Third degree burns in both palm of the hands. How much is both palm of the hands? It's 3. Okay, so who will you prioritize more, 3 or 4? It would be number 3 because they fit in the criteria of third degree burns of more than 5% for any age group. Let's cancel out 3 and 4. Who will you prioritize next for 1 or 2? You have your second and third degree burns for 49 years old and a 9-year-old client with second and third degree circumferential burns in the anterior side of the left lower arm and posterior side of the right upper arm. Who will you prioritize next? It's your number 2. Okay, it's your number 2 because they are below your 10 years of age, and besides that, circumferential burns in the anterior side of the left lower arm. Left lower arm is 4.5 and posterior side of the right upper arm would be 4.5. So somehow it would yield a 10. Okay, so still it's number 2, and then we can go for number 1 at the next time. Okay, so do you understand how you would prioritize your burn clients? Do you guys understand? Do you guys understand this one, this concept? Okay, so again, look for the third degree for more than 5%. If there is none, you look for the second and third degree burns of 10%. That should be within the age below 10 and above 50. If there is none, you look for the next one. Second and third degree burns of more than 20 for the between group, 11 to 49. So next, again, the ABCs of trauma take precedent over caring for the burn. So here is an example of your different degrees of burn. This one is a classic example of your first degree burns, your sunburns. Okay, there would be like a dry red skin. For your second degree, there would be blister formation. For your third degree, okay, there would be your fatty layers showing already that would look as though it's leathery. Okay, there would be white layer for the skin. And lastly, for your fourth degree, there would be the burning of your muscles and your bones. You would see the muscles and the bones looking like this because there would be your eschar formation already. Now here, the nurse is providing care to a child with third-degree burns of 25% of the total body surface area. Assessment of the child reveals rapidly decreasing level of consciousness, clammy skin, and disorientation. The nurse considers these as related to which of the following conditions? Third-degree burns of 25% of total body surface area. Question: will there be massive fluid loss? Will there be massive fluid loss? Yes. Therefore, if your patient has decreasing level of consciousness, clammy skin, disorientation, or confusion, that could be a sign of your dehydration. Correct. Next, let's look at some findings or assessments that could be a sign of a complication. Your change in LOC, fever, fast heartbeat, and fast breathing could be a sign of your sepsis or massive infection, severe infection. Your confusion, hypotension, weakness, rapid heartbeat, and cool, clammy skin could be a sign of your, what do you think this one is? Could be a sign of your dehydration or your hypovolemia, loss of fluid. Your confusion together with your drowsiness, slurred speech, and shivering could be a sign of your hypothermia. Your abnormal heart rhythms, weakness, muscle fatigue, tall peak T wave could be a sign of your what? In terms of your electrolytes, what do you think is the problem if your patient has tall peak T waves, abnormal heart rhythms? Your hyperkalemia. Now, how come your burn client suffers from hyperkalemia? Guys, remember that your muscles also somehow stores your potassium, right? Your potassium is very much needed for your muscles to grow, right? Now, when there is damage to the muscles, the potassium will leak out to the bloodstream, causing now your hyperkalemia. That's why your patient also will have tall peak T waves or cardiac arrhythmias if they have burns. Lastly, your fever, purplish discoloration, swelling, greenish discharge, or pus on a certain area could be your, what could this one mean? Okay, your infection or wound infection. Now, before we go on with your disaster nursing, let's have your lunch break. Okay, can we go for 20 minutes because we still have a lot to go? Can we go for 20 minutes? And I might extend for a bit today. So for those who cannot extend, that's fine. We can send you the replay anyways. But for those who can, I might extend for a bit. Okay, so 20 minutes for your lunch break. Have a fun lunch. Have a fun lunch. And I'll see you afterwards.